So good morning to everyone and good morning to dignitaries and all the participants for today's annual CME of Association of Industrial Psychiatry of India. And this is the CME that we are conducting on web. And today will be our first academic session, that is the keynote address. The topic for today's keynote address is imperatives of workplace psychiatry. And the speaker is our very own guest of honor, Professor Dr. Afzal Javed, who is currently President of WPA. And the chairpersons for today's session would be Brigadier Dr. P.K. Chakraborty and Dr. P.K. Dalal sir. So let me introduce you to the chairpersons today. The first chairperson for today is Brigadier Dr. P.K. Chaudhary. He has been the past president of AIPI. He joined Army Medical Corps after his MBBS, did his postgraduate.
Let us correct. This is Brigadier Dr. P.K. Chakraborty.
Chakraborty, yes sir. Sorry sir. Yes sir. He has been the consultant psychiatrist at AFMC, that is the Armed Force Medical Services, and he has been the ex-senior advisor psychiatry professor in HOD Department of Psychiatry at AFMC. He has more than 36 years of service to Army Medical Corps. He took part in the Indo-Pakistan War in 1965 and 1971. He was deployed in Counter-Insurgency Corps 2. He has been awarded a GOC in C, the Eastern Command, and Commendation Card on 26th of January. Also, he has been the ex-member of the editorial board of Medical Journal of Armed Forces and Indian Journal of Psychiatry. Good morning, sir, and I welcome you on the dais today.
Thank you.
And then the next chairman for today's session would be Dr. P.K. Dalal sir. He is currently the president of Indian Psychiatry Society. He is the professor in HOD, Department of Psychiatry, KGMC, and he has been there since he has been HOD since the year 2010. He is in charge of de-addiction psychiatry at KGMU. He has more than 27 projects running under him. He has been the manuscript reviewer of national and international journals. He has more than 222 publications in national and international journals, and he has authored many book chapters. He has been awarded the Dr. B.D. Sethi Oration Award, the Tara Naidu Award of IPS, that is of Central Zone, Professor A.D. Engineer Award, KGMU Award for Excellence. He has been in the past the president of IPS Central Zone, 2004 and 5, editor of IPS Central Zone from 97 to 2003. Sir, I welcome you also for today's session. And I request the chairperson to introduce us to the chief speaker for today's keynote address. Thank you, sir.
Thank you.
Flashing the details of Professor Afzal Javed. Welcome, Professor Chakraborty, sir. Will you please introduce Professor Afzal Javed, sir?
Okay, thank you. It's my pleasure to welcome and introduce our Professor Afzal Javed. He's the president of World Psychiatry Association since October 2020. He's a consultant psychiatrist and honorary professor, Institute of Applied Health Research, University Birmingham, London. Honorary Associate Professor of Mental Health, Wellbeing, Warwick Medical School, Chairman of Pakistan Psychiatric Research Center. He served as in the Royal College of Psychiatrists as Deputy Associate Registrar and Chairman of West Midland, past President of AFPA and WPA. His areas of interest is social and transcultural psychiatry, psychosocial rehabilitation, and psychiatric research. With these few words, I request Dr. Afzal Javed to give his keynote address on the imperatives of workplace psychiatry. Thank you.
Well, good morning, dear friends and respected chairs of the session. I'm really pleased that I have been invited to this particular meeting. I hope that I'm able to share my slides. Are my slides open?
Yes,
Yes,
sir.
sir, they are. Yes,
Yes,
yes, sir.
Well, as I said earlier, that this is really a sort of a nice introduction to the Industrial Association of Psychiatry of India. You are really setting a scene which is not only important for India, but equally important for the region and the international psychiatry. And this is one particular area that is going to be significantly important in the 21st century. And I must congratulate all the past presidents, the founders, and the organizers of this particular Congress for highlighting the issue of workplace mental health. And it is always nice meeting and seeing Professor Dalal and Professor Gautam Saha, because their leadership in Indian Psychiatric Society is setting high standards of care, passion, and leadership. I have given my disclosure, and during the next 20-25 minutes, I will just try to re-emphasize that why mental health is important, and within the mental health, the workplace mental health and well-being is equally significantly important. And just to re-emphasize what has been said in some of earlier talks, that how work stress impacts on the well-being, and that has got long-term consequences and effects in many areas of our life. And then I'll just try to emphasize, especially on the interventions that involve public health approaches for our workers, for our companies, and for our audience in general. It is a very old slide, but I think this is very important to show in our gatherings, just as a reminder that how important psychiatric disorders are. Despite the burden of disease from the mental illnesses, which is around 25 to 30% globally, it's a pity that we are not getting the attention that needs to be given to mental health, mental disorders. And mental disorders and mental health problems always stay as underestimated, disabling conditions. Due to the high prevalence rate of mental disorders, it is not only the mental health that is affected. We have to really pass on this message to all our physician colleagues, especially that with mental disorders, there are high rates of health risk behaviors. There is ample evidence that the physical morbidity and the other comorbidities are now becoming a norm rather than exceptions. And many studies have shown the life expectancy of our patients who suffer from mental health problems is much lower as compared to the general population. But in addition to those factors, the other social consequences on education, employment, social interaction, stigma, all these compound the effects of mental health and argue for an important case in the field of medicine, in the field of social and healthcare. Now, coming to the workplace, mental health problems like anxiety, stress, depression are widespread. And the recent phenomena of burnout is becoming a very important and visible condition that is linked with the workplace stress. And there are so many reports from the West that show, especially the professionals who are also workers, who are also in their own capacity also considered as participating in the industry, whether this is a health-related or social-related industries. And their burnout is an example that how stress at work can complicate and can influence the long-term effects. And then there are a number of reports by World Health Organization, reports by World Federation of Mental Health, and many national and international groups. The research shows that workplace stressors such as long hours, economic insecurity, work-family conflict, high job requirements, all these factors impact the well-being. So these are the issues which may not look like medical to begin with, but we do understand that they have a number of psychosocial consequences. And as I mentioned that burnt out is having a growing impact on workplace, particularly in advanced economies and the developing economies. We see that low and middle income countries, they are thriving on industry. They are thriving on the business. Their emphasis is on improving the economy. For example, India is one of the biggest economies in the world, and it's a growing economy. At the same time, if we omit or neglect the burnout or the consequences of workplace stress, unfortunately, that will be highly significant in our future plans. I'll just give you a couple of examples from the developed world. Mental Health Foundation in UK recently published a very important book and monograph, How to Support Mental Health at Work. And their findings were quite alarming. For example, as per their observations, around 70 million work days are lost each year due to the mental health problems and costing approximately billions per year. This is a hidden side that the policymakers, the employers, and the other people who manage industries are not fully aware. And then most people with ongoing mental health problems actually meet the definition of Disability and Equality Act. So this is another area that can put a lot of resources when we are talking about empowering the people and encouraging that this particular issue comes under Equality Act and Disability Discrimination Act. Another study that was from Deloitte Center, they again did a very expanded work in the UK. And their report showed that the issue was more pertinent when it came to the awareness of the employers and the managers about the importance of mental health. Just look at the findings of their report, that only 22% of line managers have ever received some form of training on mental health at work. Now, when they are not exposed, when they are not sensitized to this, how can they identify the problems in their workforce? And then it was also evident in their report that more than a third of employees did not approach anyone last time they experienced any mental health issue. Now, whether this is stigma, whether this is ignorance, whether this is denial, this is very significant, as the effect and the impact of these problems are directly or indirectly seen on the productivity and the well-being of the staff at the workplace. Similar work from US that has shown the alarming trends in terms of the problems that people experience and report at the workplace. This was a very important study, and I just want to emphasize on one point. This is about the new generations, what we call that Z or new generations, which are after the millennium. And this particular generation that is going to look after the economies, the generations going to look after the future of any country's economy. And the study and the survey reported that more than a third of the group, they reported having problems or even going to the extent of leaving job partly because of the mental health. So this again signifies that if the new generation, if the new employees are facing these problems, how important we have to take this further. And statistics related to mental health in general are also very compelling. If we look at how much impact of mental illness and mental health can have in a society, and then if you compare it, if that is linked to those who are building up the society, the difficulties will be more significant. So what are the risks that are linked to the problems at work? It is not only the depression, it is not only the mental health problems, but it is also linked to the lifestyle behavior of those people who are undergoing stress or who are not managing the work stress or even other related stress which are linked to their productivity. And now there is again a lot of studies clearly linking the effects of mental health problems with the physical health, including blood pressure, diabetes, obesity, and many other health risky behaviors that could actually increase the impact of the compounded effects of all these problems. And then there are incidents of many other costly diseases that could be directly or indirectly linked to the high prevalence of mental health problems. The professionals who are present today, I mean, they have seen a number of cases that people who are undergoing psychological stress are at higher risks for diabetes, heart disease, and many musculoskeletal disorders. So that furthermore emphasizes that we have to really give due attention to this workplace. Brigadier Raju have given a figure around 500 million workers, a big number of people who are directly exposed to many hazards of the workplace. And this is not only important in terms of their health, but also important in many other ways. So what are the ways forward? What can be done? I think the most important thing which we need to done, and that has been done by the Industrial Psychiatric Association of India today, awareness, recognition, and dissemination the knowledge among the professionals, among the other stakeholders. We do appreciate that there are a number of barriers. For example, it could be costly, it could be related to the financial aspects by the employees, and they would really need increasingly high resources to cope with mental health problems. But if the companies are fully aware that mental health services should be accessible and there should be some help available to control and to manage the stress at the primary level, a lot can be saved at the end. So, employees, of course, need increasing resources to help their employees. But achieving health in the workplace, that begins by building and sustaining workplace culture that enhances health arrangements. I think presence of so many other stakeholders who are sitting on the other side of the table during this Congress will actually make this message very clear. Awareness, recognition, and acknowledgement. And there are so many interventions, not necessarily medical interventions, but the public health interventions that can play a big role. And this is probably a big message that we need to pass on, that primary prevention and the promotion of well-being is equally important as we believe in treating and managing problems. WHO has alarmed many years ago that health is not simply absence of disease, but this is also means a good health. I always believe that mental health all over the world is always linked to mental illnesses. I think we professionals have now need to come forward and say that mental health simply doesn't mean mental illnesses. Mental health also means good mental health, positive mental health. And this is a message which can really propagate our vision that it is not only that you treat, it is equally important that you emphasize on prevention and promotion. So to conclude, Mr. Chairman, I think the workplace represents major challenges, and the workplace, mental health at workplace equally needs more important, more visibility, and more acknowledgement. And we have to really make a case that a number of mental health cost burden is directly related to the productivity loss. This could be unemployment, this could be disability, this could be absenteeism, this could be lower work performance. So we have to really develop a culture that it is not only for the sake of the person who is suffering, it is also in the interest of our employees and the industry, that if they take care of their workers' mental health, there are a number of variables that can affect and can even improve the productivity. And by addressing mental health at work, psychological disorders, we need to really approach and do some public health work and public health efforts. In many big industries in the West, there is always a link with the public health department. I think this is something, it may be that small industries may not be able to afford that, but having a joint effort, combining effort by small industries to develop a workforce in the area of public health and public mental health may be the answer for our future directions. And I would really like to conclude that what WHO has propagated, that health is not only the absence of disease. In its broadest application, good health means good physical health, good social, financial, emotional, intellectual, and spiritual well-being. So this is probably, if these messages come from doctors, if these messages come from physicians, that it is not only the tablet which is important, it is the way of life. It is the way how we can really proceed. I think in our society, especially in our region, whatever the doctor says, that is the final word for the patient and for the family. And if our doctors and our professional colleagues who are dealing with these mental health problems also start promoting the public mental health approach, that would become an example to be followed, especially in the perspectives of industrial psychiatry. So, Mr. Chairman, and ladies and gentlemen, this is the logo, this is the slogan, this is the objective of World Psychiatric Association during the next 3 years period, that mental health should be practiced as public mental health. And I'm so pleased that Indian Psychiatric Society, Indian Social Psychiatry, Indian Private Psychiatry, these are the big societies of professionals who are helping World Psychiatric Association to propagate this particular slogan. And I hope that this particular meeting will also highlight the importance of this topic, subject, and our colleagues, friends, other stakeholders who are on the other side of the table will look at some public health interventions when it comes to recognition, awareness, and acknowledgement of mental health problems. Sir, I once again thank you. And I must say that this particular Congress has looked at an important and unfortunately neglected aspect of mental health. Thank you very much and all the best for the coming presentations and the scientific program.
Thank you, Professor Afzal Javed, sir, for your illustrious and scholarly presentation relating to industrial psychiatry and the problems in the workplace. As the keynote address doesn't invite any question answer sessions, so I will be giving my remarks, and then I will request Brigadier Chakravarti Saab to give his concluding. Professor Javed sir has very, so I will be just giving my comments that we all know about the workplace problems, especially the problems which we have already seen in this pandemic. It has given us a great, lesson that about migratory workers and about, say, job loss and economic problems, hardships, as well as leading to so many mental health problems arising in them. So what I believe is that what we require is data, that as Professor Javed had said, that there is a hardcore data that because of this maybe mental health issues or physical issues or absenteeism, substance use and all these things, there is a loss of $2.4 billion every year in UK. So if we can gather that kind of a data in collaboration with the industrial society, before that we will have to have some specific data, say for our country, that how many people, if we can generate that data, suffer with maybe chronic physical disorders as well as chronic mental disorders, and mainly with our common mental disorders, which are probably in abundance, and including substance use disorders, which is leading to so much of work impairment as well as absenteeism. So we will have to generate that data and to show to the government that if we really can help these industry people, and we will have to collaborate also to the industry people, that how to take care of this malady, in fact, so that the productivity increases and their share also increases. And similarly with that, they can invest more in the welfare of industrial workers, for their workers as well as their family members, which are huge in numbers in our country. And for that also, our psychiatric armamentarium, we also require certain industry specific scales to evaluate that what are their requirements, and whether there is a mild problem or related to their industry workers, whether it is mild, moderate or severe, and how to deal with them. And as Professor Javed has said, that smaller industries, it may be very, very difficult for them, but they can of course collaborate with governmental and as well as private and non-governmental psychiatric say institutions or disciplines or hospitals to deal with such problems. I can give you one example, is that my elder brother retired as a group general manager of ONGC, and just before retirement, he was called to Delhi for a 2-week training program to how to take care of retirement blues. So these kind of things are also very, very important, that induction training and say mid-level training, or when they are there, as well as at the time of retirement. So all these things are very, very important aspects of any worker who spends his lifetime. I would say around 2/3 of their lifetime they probably spend as in the workplace actually. So that is a very, very important for the employers also to understand that they are there standing behind the well-being of the employees. So it's a collaborative kind of a thing. And as Professor Javed has said, that actually many of the workers or even officers, they do not come out with their mental health problems because of the fear that probably they are going to lose their jobs, or they will be castigated, or they will be looked down by their industry, by their colleagues and by their seniors. So that is a very, very big barrier. So to break that, the employers must inculcate some amount of I would say faith and confidence in their employees, that physical as well as mental health help is available to them for their well-being, and so that the productivity increases and they can the workers can also live a good life along with their family members. So with that, I thank the organizers for giving me an opportunity to chair one of the person in the world of psychiatry, Professor Afzal Javed's I would say illustrious lecture. Thank you, ladies and gentlemen. May I now request Professor Chakravarti to give his concluding remarks.
Thank you, Professor Dayal. We just heard a very lucid talk by Afzal, President of WPA,
large amount of,
and he has really enlightened us the importance of workplace in our mental health, which is more often neglected. And I also thank Professor Dayal for giving a very good suggestion about the induction training, mid service training, as well as pre-retirement training to the workers. It will definitely help us in eliminating most of our mental health problems, especially after we retire. So with these few words, I, not only on my behalf and also behalf of Professor Dayal, thank these organizers for giving us the opportunity to share the important topic, the imperatives of workplace and psychiatry. And I'm sure all of you have benefited for this lecture from Professor Afzal. Thank you, everybody. Thank you all.
Thank you, everyone.
Thank you, everybody.
Okay, Afzal.
Thank you, everybody.
Sir, thank you so much. If Dr. Tufan sir allows, can we declare the e-poster and request Dr. Afzal Javed to announce the winners?
Yes.
Do we have the slide for that?
So, Dr. Afzal Javed, he requests you to announce.
Well, thank you very much.
Yes, sir, we had an e-poster session in the morning.
We have an e-poster session. There is a very good response from all over the country, and we shortlisted 10, and they presented today morning before we started.
Yeah. So, sir, we had more than 30 papers, out of which 25 were selected for the participation, out of which 10 were shortlisted for the award. And of these 10, these 3 are the awardees. Sir, if you can announce these names.
Well, it's really a privilege, and this shows the actual output of this Congress, that you are not only generating an interest, but you are also generating some hope and further enthusiasm among our general and especially young colleagues to take part in this particular topic. So with my player, I announce the winners of the poster presentation awards: Dr. Sharayasi Das, Dr. Ankit Halder, and Dr. Kalyani Redder. Congratulations to these award winners, and we hope that they will continue their interest in this particular area of psychiatry.
Congratulations, winners, and thank you, Dr. Javed, and for providing them the satisfaction.
Thank you so much, sir. Sir, let me also thank the judges for this award. They were Dr. Sameer Praharaj, Professor and HOD of KMC Manipal, Dr. Ajay Bagle, Additional Professor RIMS Ranchi, and Dr. Sharda Swain from Cuttack, Professor. And Dr. Sai Krishna, he coordinated and did most of the sweating. So thank you all the judges, moderator,
I think
and
Dr.
all
Sai
the
is
papers.
here.
All the papers were good.
Is Dr. Sai
Over
here? Anybody who is here, please surface.
Sai is, I think, he had to join the work, so Sai is not here, I think.
I'm sure he's not only joining the work, he is also going to take care of the stress at work for others.
Yes.
Okay. Thank you.
Absolutely. Thank you so much, Sir Javed, sir, for announcing these awards. I think this is a great honor for the candidates to be announced by the...
To be awarded by the President WPA.
Yeah.
Let us...
Over to you, Tufan, sir.
Yeah. So thank you very much. Thank you, Alim, for nicely conducting everything. And thank you, Dr. Javed, for erudite address. And that is why I have been bothering you at times, not always.
You are always welcome. You are always welcome. You are
actually calling him like very much. Always we are bothering him.
It has been a brilliant speech. We will get inspiration from this speech, and we look forward to your continued indulgence in the Association of Industrial Psychiatry. Thank you very much for sparing so much of time.
Thank you, sir.
Brigadier Raju, because Dr. Dalal and Gautam Saha are also here. I think what Dr. Dalal has suggested my suggestion would be initiate some survey or study across the region on this particular topic, because that will be a very forceful message going from the SARC region about the importance of this. I think that is a wonderful initiative by Dr. Dalal, and let the SARC Psychiatric Federation should take this.
We'll do that. Thank you, sir. We'll do that.
Thank you.
Definitely we'll
Thank
interact.
you very much. Thank you.
Tufan sir, shall we move on to the next session? Sir, you're muted.
We have to thank again the chairpersons for kindly conducting the session. We are thankful to Dr. Chakrabarti and Dr. P.K. Dalal, our dear Dr. Dalal and President of IPS, for nicely conducting the session. Thank you. Next, we'll move on to the next session.